Welcome to DPC Pediatrician. We're Dr. Phil Boucher
and Dr. Marina Capella, two DPC pediatricians who are on a mission to share our love of direct primary care with you. Welcome to our first ever episode of DPC Pediatrician. We're so excited you're here. I'm Dr. Marina Capella, and this is my colleague, Dr. Phil Boucher.
Yeah, I am just so excited to be able to get to talk about DPC with you.
Yeah, we both started our practices not too long ago. I'm about 2.5 years in. And Phil, how long have you been doing this?
I started just over 2 years ago as well, and just kind of had like a 6-month lead up to starting my practice. So I've been in the open practice for 2.25 years now. And then kind of the 6 months before that, also kind of getting things ramped up.
Yeah. So we haven't been in this DPC pediatrician space for too long, but we've learned a lot in the 2+ years that we've been in it. And we are so passionate about DPC, or in our case, it's direct pediatric care, that we want to start sharing our passion, our love for DPC with other pediatricians, because it's really been a tool for us to recover from some burnout, to have more work-life balance, to enjoy the practice of medicine much more.
Yeah, I think that there's so many pediatricians out there that are having a tough time right now, and most feel like there's no escape hatch. There's no way to be your own boss and be an entrepreneur and do all those things. And I think that once you get into it, you realize, okay, there's a lot of people in the world that start their own small businesses. And so it's not like I don't have the ability to do that. I mean, I went through undergrad, medical school, residency, all those sorts of things. Like I have the ability to learn new skills. And I think that once you get over that mental block of I could never do this, then it becomes something where you get to make it your own. And I think that's what is the really fun part about getting to talk, the two of us, is that there's so many different ways to approach pediatric DPC that it'll just be fun to have a conversation around different ideas of direct primary care.
Absolutely. And I couldn't agree more with your statement about we are physicians. We've done so much. We're experts at learning, if nothing else. And so if we can learn how to do lumbar punctures on babies, and we can learn how to diagnose complex conditions, we can learn how to start a business. And I remember someone when I was starting up saying, hey, if John down the street can own a bike shop or a restaurant, like you can own a business. And that really stuck with me, because I think there is a lot of self-doubt. We are taught that we are excellent physicians, but sometimes we even hear that we're bad at business. And that's why MBAs need to take over the hospital and things like that. And that's absolutely not true. I think being entrepreneurs and physicians is a way to take back our power within the field of medicine.
Yeah, I think that is ingrained in you from day one. Is business is too hard. It's too complicated. You could never figure it out. So you might as well work in academics or work for a big employer that will take care of all those things for you in exchange for the pound of flesh that they ask for in all the different ways for all the years in practice. And then I try and remind people too, like there's a million, like literally 1 million small businesses started in the US every single year. And 99% of those are by people that have much less training, experience, education, and ability to learn than physicians. And so if anybody can start a small business and figure out those things, it's somebody that knows how to learn and knows how to implement and pivot and all of the different things that physicians do every day of the week.
Couldn't agree more. All right. So today in this episode, we want to just introduce ourselves. So I'll be starting off asking questions of Phil, and he'll ask me questions so that you all get to know a little bit about us, where we're coming from, our stories, our successes, and our struggles as well. We want to be pretty transparent in order to help you learn the things that you need to learn to launch and grow a successful DPC, if that is what feels like the right choice for you. All right. So I'll start out. Phil, tell me about your life before becoming a doctor, just your background.
So I'm kind of the boring route of I went to undergrad. So I grew up here in Lincoln, Nebraska, which is where I'm in practice at. So I practice in my hometown. I went to undergrad here in town and then went up the road to Omaha for medical school and then went straight to residency after that. Like I didn't do any of like the fun adventures or paths that lead people to medicine. I have 6 kids. And so we started having our family when I was in medical school. So 3rd year medical school. We had our oldest Jane, who's now just turned 14 this past week. And outside of medical school, I think the fun things about me before becoming a doctor were I like to teach. And so what that looked like in undergrad was being a TA in some of the different biochemistry and anatomy and those sorts of classes. And then I taught for Kaplan too, which was actually really cool because at the time, I mean, it was kind of a lot of work, but they paid really well for undergrad and medical school, lack of income stream. And now a lot of my MCAT students are physicians in my community and I see their kids. And so it's been very fun and full circle way to use that passion for teaching that I really enjoy to see like that come to fruition in a really fun way of like just getting to see how doctors have landed back in our community that I taught their MCAT class a million years ago.
Excellent. Yeah. So moving on after medical school, where did you work before you started your current DPC practice?
So I was lucky in residency. I remember the day because I was on call in the PICU, and the practice manager called and offered me a position here in Lincoln. We had done interviews and all those sorts of things. So I actually knew second year of residency when I was on a PICU rotation that I had a job lined up for a year and a half down the road. And so it was a really fantastic clinic that I got to work at and become one of the owners of. Is a group of 10 pediatricians in private practice at one location in my community that I'm still in now, and worked there for 7 or 8 years before transitioning over to DPC. And so that was a really good experience to learn all of the different pediatric stuff that you really don't learn in residency that you learn on the job. And then also the business side of things as a practice owner, all of the different business aspects I got to learn and experience before setting out on my own.
Excellent. And I'm curious, what motivated you to open your DPC, especially having been a partner in a successful practice? It takes a lot
Yeah.
of gumption to do that. So tell me about what your motivation was.
It was a combination of things. It wasn't on my bucket list when I started, or even 5 years, or honestly, 7 years into my private practice ownership that I had ever considered DPC. It was something that I like to listen to podcasts a lot. And I was listening to a lot of podcasts on just kind of like how medicine is changing, and came across one that was talking a lot about direct primary care. And then it kind of just started to like gnaw at me that like this would be a really cool way to practice. And I always like doing entrepreneurial stuff, and like the risk of trying something new always appeals to me. And that combined with lots of personality issues of the practice that I was at led me to say, okay, this is the time to jump into direct primary care. It was the worst possible time for me from a life standpoint to jump into direct primary care. We were expecting our sixth child who was going to have a planned NICU stay for preterm delivery. And we were 3 months away from finishing building our home. And so, like, it was a
Wow.
stressful time period to take that on, but just the culmination of events related to partner issues and things along those lines. I turned in my notice of resignation like a week before our baby was due, and then had the 6 months in the summer and into the late fall and start of 2022 to put my practice together. So it was a busy time and it was a stressful time for sure. And there was lots of issues that come with leaving as an owner of a practice that you've been there for that long. Like it was just a divorce. And so that
Uh-huh.
was not easy, but it turned out to be the right time. And I'm glad that I did it then and it all worked out then. Like it was not a pleasant 6, 8 months going through that.
Uh-huh.
But that was kind of what motivated me, was the culmination of events of DPC gnawing at me, and then lots of things that said, okay, it's time to break loose and do something else. That led to pediatric DPC for me.
Excellent. Yeah. And I'm curious, so you mentioned some of the challenges in making that transition from fee for service to DPC. What were some of the biggest challenges you faced once you had your foot in your own DPC and building that practice? What was that like for you?
The biggest challenge for me, I think, has been teaching patients what DPC is, because especially in the pediatric realm, it's not as common. It takes explaining the model repeatedly and for people to see the model repeatedly to understand why it might be the right choice for families. And so I think that has been the biggest challenge consistently, is making sure that people understand how it works and the why, and why somebody would do that. Because my pediatric DPC is the first one in the state. It's not something that people are super familiar with, and most people are used to their insurance and the way things go and the way that they've typically done it and always done it. So it's really something where it's kind of one of those record scratch things where you have to really explain to them repeatedly why they might consider that and why it might be the right choice, then once they do, they're hooked on it and just can't imagine going back to a traditional practice from a patient standpoint. Other challenges business wise, I think it's just all the learning of how do you actually start a business? How do you file your taxes as a business owner? How do
Mhm.
you do bookkeeping? And how do you do all those businessy things that no one has
Mhm.
ever taught you, that you might have an
Yeah.
idea of, but until you're actually like logging into your QuickBooks account to reconcile your accounts and things along those lines, it doesn't really hit you. I mean, they're all figure outable. Like they're all a couple YouTube videos away from where you're at right now. If you don't know how to do those things, they're not complicated, and they're much
Mhm.
easier than they were a decade ago or 20 years ago or anything like that, because it's all computerized and automated, and there's so many good tutorials and people to help you now, where in the past you probably had
Mhm.
to go like get a book from the library or something. That those
Yeah.
are the biggest challenges, I think, and it's all these like hurdles. Like I always think about it, and I'm rambling now, I know, so I'm going to finish this up. Like you get to biochemistry in undergrad, and you feel like this is what's going to weed me out. This is, I'm not going to make it through biochemistry, and then you do, and then you go on to whatever else is next afterwards, anatomy or physiology or neuroanatomy, and you keep not getting weeded out. And so you can definitely not get weeded out of the business side of things. It just takes the time of figuring out how does this work.
Yeah. You mentioned that you have to explain the DPC model to your community and your patients a lot. That being said, you ramped up pretty quickly. I think you're probably one of the pediatric practices who has been most successful in getting to a few hundred patients relatively quickly. How do you think that happened? Did it take a while in the beginning? Was there a critical mass after which people
Yeah.
just started spreading the word?
So I had a thriving big practice when I left my fee for service practice. I had about 2,200 patients, I think, and it varied. Like you do the little EMR calculation of how many patients you have, and that doesn't really speak to necessarily how many know you on a regular basis or see you on a regular basis, other than the checkup or they moved, but they've never, notified anybody that they left. So 2,200 patients. So I initially about 5% transferred on day one with me. So that amounted to about 100, 120 patients or so
Nice.
from there right out of the gate, which was really helpful as a way to get started and to know, okay, this works.
Yeah.
Like the few
Uh-huh.
of people came, it makes sense to them, or they're at least going to give me a try and see how it goes. Then it was a slow, steady climb, and I think the critical mass was probably around 200 patients, where you get to the
Mhm.
point where like, okay, this has legs. We need to formalize everything and standardize the approach to everything, because it's getting a little bit on the busy side. And
Mhm.
within 18 months, we were at about 500 patients. And now at
Wow.
2 years, we've slowed down because we've kind of started a wait list to some degree. And so we're at about
Uh-huh.
560 patients now at the 2 year mark, and
Mhm.
continue to grow, especially with new babies. We've kind of put the brakes on a lot of new, bigger families joining so that we have room
Mhm.
for new babies. But the new baby pipeline has remained steady.
Excellent. Excellent. All right, last question for you. What would you say has been the biggest reward of having your own pediatric DPC?
There are so many things. It's hard to pick what the biggest reward is. I think for myself as a professional, I really enjoy the challenge of being a business owner and figuring out all of the different things. I think the other thing that I love is the flexibility that you get in direct primary care. Just the other day, we were talking about kind of like some of our DPC wins and everything along those lines. Having the flexibility to, on Wednesday, just a couple of days ago, go to the hospital and see a newborn baby, do a meet and greet with the family, do some checkups, do a newborn home visit, and then go to a family's house to do a home visit for a child that's medically complex and has difficulty leaving the home. And then while I'm out,
Mhm.
somebody texts a picture of a huge gash in the forehead that was acquired on the playground. And so go
Uh-huh.
back to the office and say, yeah, come on over, we'll stitch you up, stitch that up,
Mhm.
and then see a couple more patients. And then somebody needed a last minute strep, able to get all of that in without a lot of difficulty or stress, or
Mhm.
having 20 patients that you had to work around to see or something along those lines. To do
Yeah.
that and then be home at 4:45 to start making dinner with my kids and family is just
Mhm.
something that is a dream. And that day I was just like, this is, I'm helping people in a real tangible way. I'm making a difference for a lot of families, and
Mhm.
I'm practicing within my ethos and what really makes me feel like I'm doing a good job, and
Uh-huh.
also respecting my time outside of work with my family. All of those
Mhm.
things felt so imbalanced that day that was just like the epitome of all of the rewards of being in direct primary care.
Excellent. Well, thank you so much for sharing at least a piece of your story. I know we're going to dive deeper in with
Yeah.
each episode. We'll be addressing a specific question that commonly comes up with pediatric DPC. So you'll learn a lot more about us and our business challenges and successes through that.
So I am super excited to ask you these questions now. And so, Marina, tell me about what your life was like before becoming a doctor.
I come from somewhat humble circumstances, I would say. My parents were immigrants from Mexico. I was born in Los Angeles, East LA, very large Hispanic population. And then my family, when I was about 5 or 6, moved out to Southern California, but more inland in San Bernardino, Fontana area. If anybody knows California, it's a big urban sprawl. But in Southern California is where I grew up, and I have 4 siblings. For some reason, I was the child in the family that was more academically inclined. So I did well in school and I was kind of ambitious. My mom was a really good role model too, though. She had sort of wanted the life of a traditional woman in her culture, sort of raising kids, staying at home. And economically, that was not working for my family. So when I was in late elementary school, she went back to school to become a teacher. And I remember going to her evening classes with her and kind of seeing what college was like. So she kind of planted that seed in me that education was a path toward a brighter future, a more economically secure future. So I knew I definitely wanted to pursue higher education because of my mom. I also remember spending a lot of summers in her kindergarten classroom when I was in middle school and even high school, because, one teacher trying to manage 32 kids is pretty hard. So she would kind of drag me or my siblings along to kind of help take care of like one of the stations in her kindergarten class or to help manage kids.
Oh, fun.
And so I think that's what kind of planted the seed of pediatrics for me, because my mom was an amazing teacher, had really great outcomes, went on to become a literacy coach and train other teachers.
Wow.
But anyway, I think like being around young kids definitely influenced my later career path. So I ended up going to college and medical school, all in California. And one of the motivations for me to go into medicine was that I had grown up without health insurance and in a community where there were a lot of underserved people that didn't have health insurance like my family did, or relied on public assistance programs. And I saw the disparities in healthcare. So that kind of motivated me to become a doctor that then served my community and helped to bridge some of those gaps in access to care. So that was kind of my life before. I majored in biology in college, and college was not easy for me. I definitely struggled in some ways. I mean, a lot of imposter syndrome and things like that. But I'm very stubborn and very persistent, and I didn't let, little failures get in my way and kept going and got to med school.
And look at you now. Tell me, like, what was it like? Where did you work before you started your DPC practice?
Yeah, so it was very much tied to my motivation to go into medicine. I started working at a community health center in San Diego, California. And so that's also called a federally qualified health center. And I loved the community that I was serving. I got to practice my Spanish, like 70% of my patients spoke Spanish, and came from low income backgrounds and, socially more complex situations. I loved serving that community, but the system in which I had to serve that community and the bureaucracy of the clinic and the organization was really hard.
Right.
So I loved my patients, I loved my colleagues, I loved my staff, but I just felt like I was trying to practice medicine a little bit with my hands tied behind my back, trying to see a teenager who's in foster care or living in a group home and having 10 minutes to try to figure out everything they need. That would just seemed impossible. Seeing a premature infant that had been in the NICU for 3 months and having just 15 minutes to deal with all of that.
Right.
It just seemed like I was practicing medicine, but not in the way that I had been taught to practice medicine. I didn't have the time to do what I felt was the best job or a really great job. So I did a good job. I did the best job I could within those circumstances. But I really felt like I was ultimately kind of shortchanging my patients and shortchanging myself because I wasn't practicing medicine in the way that I knew I was capable of doing.
Well, I think that speaks a lot to the, when we talk, and there's been a lot of talk pre-pandemic and then with the pandemic about moral injury in medicine. and how
Yeah.
what that looks like. It's not just like too many demands on your time or too much paperwork or those sorts of things, but it's practicing in a way that does not fit with your values and ethics. And when you're saying,
Yeah.
I only have this much time for patients that need a lot more time, so I'm shortchanging them, and it doesn't feel right to my values that like I can't give patients what they need, that really comes
Yeah.
into play and leads to that burnout and that injury that
Mhm.
happens.
Yeah, I'll also say that after about 4 years of working there, a family situation necessitated my husband and I to move to Utah, Salt Lake City, where he had grown up, and to become caregivers for his mother. So that necessitated a whole change in my work. And I was feeling burned out. Really, like 1 or 2 years into practicing medicine, I was feeling burned out. And I remember feeling so confused about that because I thought, really? I just gave up a decade of my life and I worked so hard to
Right.
get here. And now I'm just like, I mean, sometimes just crying on the way home from work because I was just so exhausted and
Hmm.
just felt powerless in that system. It just seemed like this is not what I signed up for, right?
Yeah.
And it was really hard to manage those feelings because I had sacrificed a lot and I had definitely gone against cultural and gender expectations in my family to become a physician,
Hmm.
and against religious expectations too. And so I had gone upstream for sure. And then all of a sudden to just feel kind of miserable. It was not a good feeling. So when we moved to Utah, I changed to pediatric urgent care for a couple of years. I practiced in that field for 3 years. And it was nice because I was able to kind of choose my hours a little bit more.
Hmm.
I did have to work evenings and weekends, but in exchange for that, I could work 24 to 28 hours a week and make about the same, enough to live on. And so I could join a running group in the morning and I could garden and things like that. So it kind of brought balance back,
Yeah.
but it still didn't feel like this was my forever job. It was just more of a job, but seeing fevers and coughs and ear
Right.
infections constantly gets a little bit old. And
Oh
I
yeah.
missed the continuity of care that I had in general pediatrics.
So, what then motivated you to go from federally qualified health center to pediatric urgent care, then to opening your DPC? Like, what was the motivation there? How did that transpire?
Yeah, great question. So after working in pediatric urgent care for about 3 years, I just kind of felt like, it was due for a change. I had worked there through the COVID pandemic through 2020. There had been hiring freezes at most organizations that year. And in
Hmm.
2021, those hiring freezes were lifted. And I started looking for what other options there were. And I applied to two positions at my local academic medical center. And I was excited about that because I thought, well, maybe academic medicine is my next step. I really like teaching, so I'll get to kind of
Hmm.
do some of that. Maybe dive into research a little bit and do the clinical. So I thought it would maybe be a better match for my personality where I like to be doing a lot of different things, not just the same thing every single day. So I applied for those positions and I came in second for both of them. And that, I mean, rejection always hurts, right? And
Right.
so I kind of had to take some time, lick my wounds, say, well, this is not going to happen. And there were some other factors that made me just feel like this wouldn't have been the right place anyway. They were not flexible at all when it came to part-time schedules, and I would have probably been working way more than I was being compensated for. So it made me take a step back and think, what does the future hold? Like, what is my ideal job? What do I really, really want? And is somebody else going to be able to provide what I really, really want? Or do I have to create it for myself? And that's the time when I discovered DPC. And it was just scouring Facebook groups where I
Yeah.
happened to read about it. And as
Yeah.
soon as I learned about it, I started, buying the books and joining the other DPC Facebook groups and starting to just read everything I could. And something just felt right. It felt like, oh my gosh, this is the thing that I didn't even know existed. This is my future. This is how I can take back my power within the medical profession, where I can practice in a way that feels good for me and is good for my patients. And it allows me to be creative in the ways that I love to be creative. And I happen to be an integrative pediatrician. So DPC allowed me to truly have the time to practice integrative pediatrics and to learn more and add more tools to my tool belt as well.
That's amazing. And I think that that is something where I think every DPC pediatrician that I know has these really special things that they do that really make them stand out because you have the time to explore those things. Where before it
Yeah.
was just, oh, 15 minutes, 10 minutes, 12 minutes, 8 minutes visits
Hmm.
all day long, got a chart, got to catch up with notes and
Yeah.
messages and all those sorts of things. You just don't have time to explore all those things. And that's been one of my favorite things is
Hmm.
exploring new avenues of
Yeah.
pediatrics that I've never been exposed to or had the chance to learn about before, and that it really makes a difference for patients when you have those really special
Uh-huh.
areas that you can bring things to. What have been some of the big challenges in starting your DPC practice and the growth of your practice?
I would say marketing and just putting myself out there was the biggest challenge. It was easy to kind of figure out the business things. I bought some books. I got like the Atlas MD startup guide. I kind of
Right.
pieced together, okay, these are the steps that I need to take, open my accounts, learn QuickBooks, set up my clinic, sign a lease, all of that stuff. It was kind of painful because I don't love doing that administrative
Yeah.
paperwork type of stuff.
It's
But
not
I
most
had a
physicians like
list.
favorite. Yeah.
Exactly. It's like charting, right? But I was able to do it and I took it one step at a time. I think it was overwhelming in the beginning because it feels like you're climbing a mountain and you're like, oh my gosh. But if you look at the top of the mountain, it's easy to get overwhelmed. So I would often just say, okay, today I'm just going to focus on this step. Today I have
Yeah.
to paint my clinic. Today I have to apply for my city license. Today I have to do this. And that made it more digestible and
Right.
doable.
Like
Yeah.
you eat an elephant one bite at a time.
Exactly, exactly. But when it came time to actually opening my doors and then waiting for patients, it was really slow. In fact, I had a really slow first 6 to 8 months where I just had a few memberships. I was offering fee for service visits as well. So just
Mm.
flat fee visits
Yeah.
because I felt like that was a way of getting people in the door to
Right.
learn about me. And then probably around month 9 is when things kind of started to pick up. And I've had to kind of be creative. I've had to hustle. So my story is a little different than yours, and that's actually I think it's a good thing to kind of demonstrate how if you've seen one DPC, you've seen one DPC, right?
Totally.
Every story is going to be different, and I have had to develop other income streams. So I became a
Hmm.
civil surgeon to do immigration medical exams, and I
Wow.
actually make quite a bit of money doing that, and that helped to kind of get me through that second year where I could grow somewhat slowly in terms of my memberships, but I still
Hmm.
made enough to then hire an office assistant, hire a medical assistant,
Awesome.
and develop a team. So I still do those, but as my memberships grow, I cut back on the number of those that I do. And I also do autism evaluations. I also get referrals from this company that deals with car insurance claims.
Mm.
They pay me directly to see kids who have been in car accidents, and I'm able to do this modality called myofascial release therapy with them to really help
Oh
them
wow.
and help them recover completely. So I have a couple of different payment sources. And so it's not like traditional straight only membership DPC,
Yeah.
but I've done what I needed to do. I've hustled in order to make it work financially so that I have the time to like more naturally grow my memberships. And I'm at about 100 memberships. It's just been kind of slow. It took 2.5 years to get there,
Yeah.
but I have these other income streams that still make it work and still make me able to enjoy the work that I'm doing because I'm not just doing one thing. Also, I'm doing a lot of different things and I love it. And eventually I do see myself being predominantly membership based,
Yeah.
but I had to figure it out. I needed the money. And so I figured out ways of getting money so that I could make my business thrive.
That is, I think, one of the things that I think a lot of physicians don't realize is like it doesn't have to all be fee for service. It doesn't have to all be membership. When you talk with finance sort of people, they talk about
Mm-hmm.
diversification. And most physicians
Yeah.
have zero diversification when it comes to their job. Like they see patients,
Mm-hmm.
they get paid, period. In
Yeah.
reality, if we can find other ways to diversify our offerings, then we're going to attract the people that we need to. We're going to make revenue. And then when one isn't creating as much revenue, there's other dials that you can turn up to bring in revenue, like you've so well done
Uh-huh.
and figured out how to make that work. And I think that's something where a lot of physicians have zero comfort with the idea of having different
Uh-huh.
things that people pay you for other than straight, you saw me, you fixed my issue, we moved on.
Yeah.
That there's a lot of other revenue generating opportunities
Hmm.
out there. And when you have
Absolutely.
more hours in the day to focus on those, then you can find a lot of joy and a lot of pride in figuring those out.
Yeah, and I think sometimes within the DPC community, doctors might hear like, "Oh, you have to just only do memberships." Like
Right.
that is what DPC is about. And please don't, you have to take those statements with a grain of salt. Ask yourself what's right for your situation
Right.
because what's right for them might not be right for you. That's one of the messages I want to convey through this podcast is that look, figure out a way that works for you because
Right.
this is your business, this is your clinic, your practice, and you're going to make it into what you want to make it. Don't try to just copy and paste what someone else has done. I mean, get guidance and advice
Right.
from other people, but don't just copy and paste.
There aren't these like commandments that thou shalt not take
Yeah.
money outside of the membership. Like sometimes there's people
Yeah.
like Moses out there that are telling you these are the commandments that you must follow. But at the end of the
Yeah.
day, like you said, if you've seen one DPC, you've seen one DPC. Everybody's is unique and you don't have to do it
Mm-hmm.
just the way everyone else says, no matter how loud of a voice that they try to have that your membership rates are too high or that you can't do this or that you can't do that. You can make it your own. And the nice thing
Yeah.
is you can experiment and see what works and what's bringing in revenue and what are patients liking and what am I enjoying, and then dial those in so that you have a
Mm-hmm.
practice that you love and that patients love, and you're able to help families thrive and thrive yourself.
Yeah, definitely.
What have been some of the biggest rewards in your practice?
By and large, I love the freedom. I love the freedom. I don't have to ask anyone permission if I want to go to a conference or if I want to
Yes,
take a day off. I can
totally.
determine my schedule. And luckily, I have a team of my MA and my office assistant are very flexible with my dynamic scheduling, as we call it, because I took a business class last fall. And so
Yeah.
I needed Thursdays off. And I said, okay, for the next 3 months, I have Thursdays off and we're just going to have to find a way to make it work. I'm still accessible via text to my patients. I happen to share my clinic with another DPC pediatrician, and that has worked really beautifully for us because she can help cover when I'm
Mm,
gone and I can help cover when she's gone. We are two separate practices, but she subleases from me and we essentially share equipment in an office
wow.
space. And that's been a beautiful arrangement. I started about 6 months before she did,
Hmm.
and then I happened to meet her. We did not know each other before, but through serendipity, we met each other. And I said, "Hey, I just signed a lease for this 1,500, square foot office space with 3 exam rooms, and it's really more than I need and
Yeah.
probably will need. Would you be interested in sharing the space?" And it saves us both costs because things like your vision screener that costs
Right.
$10,000, like we can share that, or
Right.
vaccine refrigerator and freezer and things like that, we can share that. So that has worked really nicely. But again, the freedom to just do it how I want. Now, that doesn't mean it's completely easy. It's not like I could
Right.
just take 3 weeks off and not think about anything,
Yeah.
right? But it's doable. And I just love that. And I love having the freedom to choose how much time I spend with patients, to choose what modalities I incorporate, to have the time to dig deeper into issues and say, let's talk about sleep, let's talk about nutrition, let's talk about your environment and stress and how you manage stress
Right.
and generational trauma and all of these things. And then let me teach you skills. I practice clinical hypnosis, which I love
Hmm.
incorporating as often as I can because it really helps teach kids strategies for self-regulation. Kids are
I love that.
naturally very imaginative, and so it's harnessing the power of their imagination to help them feel better. So I love just the freedom to use as much as I can learn in that clinic setting.
I think you encompass so many of the things about freedom that physicians are missing. And I think when you talk
Mm-hmm.
about it's not just a schedule freedom, it's the freedom to practice the way that you feel is
Yeah.
best and to not feel restricted by what you can offer based on what insurance is going to cover. It's the
Mm-hmm.
freedom to practice when and where it's appropriate, which means you might be able to just do things over text message and save you the time in the office and the patient from traveling across town to sit in the exam room and waiting room when there's things that you can do in a very safe, effective, evidence-based manner over text message or going
Yeah.
to somebody's home. Like I don't do a lot of home visits. We do newborn home visits, but we don't do home visits otherwise. But like I said earlier, we have a family where he has severe autism and it's really hard for him to leave the
Mhm.
home. And so
Yeah.
I just go to his house, and that's something that I just got to decide for myself. I didn't have to run it by anybody to say, is this okay? I didn't have to justify it. I said, this is what feels right for me and right for this patient. I can't do this for 500 patients, but I can do it for this one and make a big difference to them. And if another patient asked, I'd probably say yes and figure out how to make it work, but no one else has ever asked. That's
Yeah.
what freedom looks like in pediatric DPC, is being able to control the way that you practice, the when that you practice, the how that you practice.
Yeah, absolutely. Well, thank you so much for answering my questions and for asking me questions. Hopefully this gave you all a chance to learn about us, who we are, and our stories, and hopefully it helped motivate you a little bit on your own path, whether DPC is in your future or in your present, or you're just exploring the world of DPC. Thanks for listening.